Hello everyone and welcome to the beautiful Helsinki this afternoon. My name is Sarah Noonan, I'm Head of Marketing at Supercharge and I'll be your host for today's webinar. So we have an exciting topic to discuss today where we will look at how to build trust in digital healthcare while also creating solutions that positively impact patients' lives. One of the biggest challenges we hear about today for health tech professionals is how to innovate in a sector with mounting ethical concerns and data privacy issues. So we're going to dive into this topic in greater detail with our panel of experts today. For the session, we have three speakers who will cover this topic from different angles. During the session, we'll dive into how these different players in the healthcare sector form trust with their audience using the latest technology, behavioral design, and content. So let me quickly introduce you to our speakers today. We have Bence, who is based in Budapest, our experienced design lead. He will look at how we can rely on psychology when building impactful digital products. We will then hear from David Katt of Diagnostics. David will talk us through how a health tech pioneer created a non-intrusive tool to help monitor and detect health risks. And finally, we will hear from Matti, Kiviluoto, who I'm joined with in studio today, who will talk us through how one of the most trusted information sources for health tech professionals today is an enabler for better patient care. So we have an international lineup today. Without further ado, let's head over to Budapest and hear from Bence. Bence, over to you.
Yeah, thank you, Sarah. Hello and welcome to the session where I will talk about how to design for behavior change in healthcare, how to build digital solutions, apps, medical devices that people trust and use to improve their health. So my name is Lukács. I work experience design at Supercharge. I have a background in psychology and design, and my expertise is the combination of two. That is behavior design, that is about designing digital solutions that help people change for the better. And when we often see apps and digital tools as kind of the cause of that, it's like being glued to screens or doing less physical activity. Uh, we all know that these apps are designed to be addictive, and they have a very strong power to influence our behavior. But at Supercharge, of course, we believe that digital tools can also be used to help people develop good habits and influence behavior for the better health and life of people. And as a digital expert and a psychologist myself, it's kind of my goal to create products that improve people's lives. So in recent years, Supercharge has been working together with various health companies around Europe, pharma companies and startups, and we work with them to come up with solutions that contribute to better health of people. And my aim with this presentation is to show you our framework and our methods on how to design for behavior change and how to build trust. So on a top level, we see three big areas where tech can play a role in improving people's health. And these three areas will be reflected in the three presentations today in this webinar. And first, a website and apps are, of course, the main source of spreading reliable and credible information on health-related topics. So people turn to the internet, to apps, to social media to get information, and it significantly shapes their thinking and actions. So Matti, in his presentation, will talk about how they created the WHO website to be a credible, trusted source of health information around the world. The second area is around tracking and monitoring health, getting data and real-time insights on your health status, and helping to know people what actions they need to take. And Olive Diagnostics is a great example to that, and David, our other presenter today, will will show you the latest innovations in this field. And there is a third topic that I will be focusing on, and that's how to help people implement the required behavior change based on the insight and the knowledge that the other two areas provide. And the reason I think it's important because the success of most health intervention is still largely depends on the users and patients' actions. So it's not enough to get good knowledge and good insights if the patients don't take the right actions. So whether it's following a therapy or using a medical device or changing your lifestyle or hygiene habits. So the question is how to design products that help people change their health habits. And I think the answer lies in behavior design, and it's a science based on psychology theory that helps understand behavior, and it's also a practical tool set that helps us implement and helps people implement behavior change and manage their motivation, carry out the actions needed, and reinforce the right habits. And it's also about building and maintaining trust in your solution by demonstrating competence, using the right tone of voice with empathy, and being transparent about yourself and your intentions. So how does behavior design work? The basic model of behavior change is what it's called a habit loop. Every behavior or habit requires these four components, and basically our job as behavior designers is to address these four components. So let's see an example via a habit that we all have. It's brushing our teeth. So first we need a trigger. It could be that we walk into the bathroom in the morning and that triggers brushing our teeth. We need motivation. We want to have beautiful, healthy teeth. We need the ability to do it. We should be able to do it with ease. And we also need feedback and reinforcement. And in this case, that's the fresh, clean feeling in our mouth. So question is, how do we apply this model to digital products? And to that, I'm showing a case study that we have done with our partner HandInScan. And the case study is about how to improve the hand hygiene habits of hospital workers. So hand hygiene kind of seems pretty trivial nowadays. Everybody supposed to know how to clean their hands. We have seen these posters similar to that lots of times in restrooms, public places. So you might ask, what's the big deal with that? And even though COVID has raised a lot of attention to this problem, insufficient hand hygiene is still a big issue, and it's especially a crucial issue in hospitals. And on average, 7% of people who get hospital care get a hospital-acquired infection. That is an infection that you get because of improper hygiene in the hospitals, and that leads to 37,000 deaths only in the EU per year. That's a huge number. And of course, there are strict protocols for hospital workers on hand disinfection, but many people still lack proper practice, and they lack proper feedback if they are doing it right. So to solve this problem, our partner HandInScan created this device to educate the proper hand rubbing methods for doctors and nurses. And it works in a way that you apply a special hand sanitizer gel to your hand, and you put it in the scanner, and it will give you feedback on how complete your hand is disinfected. And so they deployed this scanner into many hospitals around the world. And the behavior design challenge that they got for us was that hospital workers were a little bit reluctant to use the scanner with required frequency. So the problem is that there is this device showing if your hands are clean, but people don't really use it enough. So let's use our behavior loop model, and as a first step, look into what causes hospital workers to skip the device. And we start with research, of course. We interview and observe people in a hospital. And we learned that there is a trigger problem. People in the hospital, they are, of course, very busy, doctors and nurses, so they simply often forget to use the scanner. There's also a motivational issue. People think they already know how to wash their hands, so they are not particularly motivated to use the scanner. And it turns out that there's an ability problem as well, because it takes effort to go to the scanner, and it's a little complicated to use. And we see that there's a lack of feedback and reinforcement as well, because there's nothing really rewarding about using the scanner, and you don't really feel and see the progress you make and the effect you have. So our job as behavior designers is to fix these components and provide answers to these one by one. So let's start with triggers. Yeah, every behavior requires a trigger. So if there's none, then we need to either find a trigger in the environment or create one. And of course, triggers can be many kind. There can be environmental. In our case, it could be placing the scanner in a very visible place in the hospital, at the community area, for example, so people will bump into it. And the next type could be habit stacking, which is linking an existing routine to a new habit. And in our case, that could be like teaching nurses to use the scanner every time after they go to the bathroom. So when they come out of the bathroom, that becomes the trigger to use the scanner. Or we can create artificial triggers, like sending personalized reminders for people to use the scanner. So once we have triggers, we can move to fixing ability. And for that, I want to show you a very powerful model to describe the probability of a behavior, and that's called the folk behavior model. And it describes that the level of ability and motivation together will determine the likelihood of an action if trigger is present. So the easier something is, the less motivation is needed. And as something gets harder, we need to be more motivated to do it. Of course, it sounds kind of trivial. And the point is, behavior will happen if we are above the action line, and it won't happen if you're below it. So our goal is to move the person above the action line. And one strategy to do that is to make the behavior more simple. So how do we do that? Well, we need to look into what causes the difficulty and try to remove the barriers and simplify the action. And in our case, the difficulty mainly came from the physical effort of going to the scanner. That's why proper placement is so important. And it also comes from the mental difficulty of like figuring out how the scanner works. So we made sure that it's really easy. You just insert your hands and it gives you the clear feedback. And third, time is also an important factor. So if you make it quick, people will need less motivation to do it. So after we fixed ability, we can go back to our model and talk about how to address motivation, of course, because the other way of pushing people above the action line is to increase their motivation. So motivation is complex and is due to many individual factors, but there are several techniques that can be applied to increase motivation. First of all, to get people's attention, we need to really play for their hearts, and we need to win their emotions. So by applying emotional design, we created this mascot who talks to them and invites them to use the scanner. And he does it in a kind of firm but relatable style. And the mascot narrates the whole experience and highlights the importance of having your hands disinfected. And the scanner also helps you set your own goals and challenges. So each time your hands are clean, you collect points, and when you reach your goal, you already have you already have the right routines because of so many repetition. And lastly, we also built gamification and social competition as a motivator by creating a ranking system of who has the cleanest hands in the hospital, comparing people and comparing departments. And this way, keeping your hands clean becomes kind of a fun challenge that you think about every day. And the last component of creating habits is adding this feedback and reinforcement element. So for that, we send visualizations on how you're doing, how you're making progress, and how you're doing compared to others. And most importantly, if you're doing well, then we make sure you feel really good about it. So every time your hands are clean, we make sure you feel successful, and these good positive emotions will eventually reinforce this habit. So trying to change people's behavior and design solutions for it requires a lot of responsibility, and we really need to make sure that it's for a worthy cause that we are doing it, because otherwise, of course, it can become a pure manipulation of people. So if we are working on a worthy cause, we need to design our solution in a way that it shows people that we are worthy of their trust too. So we need to demonstrate our competence and reliability. We need to use the right tone of voice, language that is easy to relate and reflect empathy to the situation. But the strongest factor for trust, I think it's about transparency, being transparent about the cause, why we are doing it, how our solution works, being honest about how effective it is, and also about how we handle data and what are we gonna do about it. So to sum up, behavior design is really an important tool for healthcare innovators, and there's really strong science behind it, and it can be utilized to have a big impact, especially when you need the collaboration of people. And in some cases, it can even possibly save some lives. So thank you, and I hand it back to Sarah to introduce the other presenters.
Super. Thank you, Bence, and thank you for sharing those insights. I think that habit building loop methodology, I think, is an incredible piece, coupled with the transparency that you mentioned in terms of building that trust. So thank you for sharing that with us. So next up, we will head over to David Kath of Olive Diagnostics. David, over to you.
Well, thanks. Thank you very much, Sarah, for having us. Indeed, I'm David Kath of Olive Diagnostics. and I'm here to talk a little bit about how with good design you can earn trust in healthcare. And the way we do it at Olive is actually very simple. We have a device that you put instead of your toilet seat. It's going to be a cheap device eventually, and it measures every molecule that ends up in the toilet by urination. The way it works, and I will explain in a little bit more detail later on, but we have a spectroscopy LEDs here, and those are emitting energy. This energy is received here in the computer with lenses, and based on what energies are lost while emitting the light, in what frequencies, we can tell you how you're doing. And usually I ask at Sarah, how are you doing? But now actually I'll tell you, you don't exactly know how you're doing because you don't know what processes are going on. And we help you at Olive, we help you trust your body a lot more. So, and the reason we do it is because care is in a terrible bind around the world. The care systems are overstretched. There's increasingly graying population, more and more people that are turning older, sicker, live longer, but there's less and less people actually supporting them, actually caring for them and giving, and the healthcare system is really in a bind. In addition, the costs of healthcare are growing, are outpacing the economy by and large everywhere. And the challenge is also to keep people at home, because with the care systems being under stress, more and more countries actually want people to grow old at home and only go to an old age home when really they can't care for themselves anymore. So that's a big situation, a big problem around the world. Also, there's other challenges in the healthcare system as well. And what we're focused on is actually meeting those challenges with urine, because urine is really the dashboard of our bodies. Healthy urine is all pretty much the same, but the moment certain molecules like nitrite or glucose end up in your urine, it means that your body is dealing with a situation. Those are actually the earliest signs of you falling ill, even before you have any symptoms. And indeed, in the Western world, about 10% of all visits to the family doctor are for urine tract infection. And in urine tract infection, as an example, the biomarkers show up days or maybe even weeks before you are actually start experiencing problems like pain or fever. The impact on the healthcare system of urine tract infection is extremely large. Just in the Netherlands, costing around 300 million a year, 350,000 hospitalization days, 1.5% of all hospitalizations. Totally avoidable. Because if you find early signs, and you can manage them. And what we do at Olive is we help with real-time accuracy to see biomarkers in your body. We can not just see them as a real-time measurement, but we can actually see the trends. So if you're an elderly lady living alone at home and you're prone to UTI, we know when your situation actually deteriorates and when a simple glass of water, an additional glass of water, should actually be administered. And because our system is just on the toilet, in the toilet, it's completely hands-free. It's easy to measure. You don't have to do anything. It's non-invasive, and it actually measures way before you would know that you would have a problem. Really taking the stress out of measurements. And as we all know in the healthcare system, if you take the stress out, the quality of your data and the quality of adherence actually improves. So you need to gain the trust of your user, of the individual, whether they're sick or healthy, whether they're old or young. You need to gain that trust, and you do that by creating a good user experience. And indeed, every visit to a toilet is a goldmine. So what we do is we have this device that I just showed you. It has Wi-Fi and Bluetooth. It sends up the data via the Wi-Fi. We analyze with AI in the cloud, and we recognize which energies are lost in what frequencies and recognize the pattern. And then we can actually say the concentrations of the molecules. We feed that back to, for example, your Apple Watch or the Apple Watch of your nurse or of a doctor or of the gym, if that's how you want to share the data. And then you can actually make those real-time insights actionable, and not just having a single measurement, as I just said, but actually seeing the trends in your health, nutrition, performance, wellness, or drug adherence, for example. I'm going to show you a quick video about our sensor to make it a bit more visual and how we do real-time urinalysis. We put it in the toilet, as I told you. We then analyze those data in the cloud, presented, for example, on an Apple Watch, and then we turn that into a repeating system, and we can recognize molecules, volume, specific gravity, pH, frequency, and color, which are together relevant for over 600 conditions, from pregnancy to kidney failure to heart failure. For example, aging, we can recognize with cortisol, you can recognize Alzheimer's, and that way we present real-time and trend-based insights, for example, electrolyte ketosis, but also smart insights that you can then follow up based on your personal nutrition, your care, the cure you need, etc. And then, obviously, we want to add more sensors to get a more rounded picture. For example, your pill box sensor. Did you take the pills? Your blood monitor. What does that say? Together, we gain a much more complete insight of an individual's health. And we do that in real time as well as longitudinal to help create and sustain healthier lifestyles. Well, this is the way it looks in more of a close-up. So these are the diodes that are receiving the light, and here there's a LED array. As you can see, a lot of different lights that are together giving a very complete and real-time picture. And we're doing that because we're on a mission. We want to be able to detect risks, for example, of stress or Alzheimer's, that you can do with the cortisol hormone, or dehydration, which you can do with volumes and volume trends, as well as the color, pH, nitrites. Same for UTI. You see inflammations way before the inflammations actually cause a fever, and by preventing dehydration UTI, as well as seeing if someone is actually urinating at night, you, as a nurse, you have the opportunity to prevent elderly people from falling, which is another major cause of hospitalizations. So early interventions become possible. It's all about doing this effortlessly on an individual basis. And for that, we built a beautiful user experience to bring our remote diagnostics without an effort. This should be seamless and well thought through UX, and that's actually what we did with the Apple Watch app that Supercharge built. If you do that well, if you do it in a beautiful way, if you do that in a continuous way, you'll gain trust. Not only the trust of the individual who's in control and that decides who to share with, but also of the medical professional, because they want to know earlier, easier, saving time, saving efforts, and caring more for the individuals that they are responsible for. Because prevention rather than cure is one of the keys that we're opening up in the healthcare system. Currently, we have biomarkers like albumin, nitrite, pH, specific gravity, volume, as well as color. We're adding them. We've actually started clinical trials in home care situations here in the Netherlands. Next month, we're expanding into hospitals. For example, with people that just underwent neurosurgery, to hypophysis operation to monitor their volumes. We're in a clinical chemical lab of one of the academic hospitals. And very soon we will also be working on following oncological patients to prevent them from, for example, dehydrating. This is the way the app currently looks, and obviously we're continuously developing it, but you can easily see your hydration levels, as well as get some tips on how and when to improve upon them if there's a problem. Obviously, we're also working on the hardware. I showed you our current version. We're working on the prototype that's actually available now, and that we will be continuously developing over the course of 2023. This enables together high-level business cases, for example, in the proof of concepts that I told you about, the trials, to reduce labor, to prevent, to help care and cure, and to improve adherence, for example, because we can recognize if you took the medication of the evening medication as opposed to the morning medication, and those actually getting that kind of trust of your patient is essential in improving healthcare. Doing more with less, and insights for early interventions and continuous monitoring actually help with that. So my name is David Katz, david@olive.earth. Thanks very much, and please, if there's some time, we'll take some questions, and otherwise, don't hesitate to reach out to me at david@olive.earth. Okay, thanks very much.
Thank you, David, and thank you so much for having a live example there to show us exactly what this product means and can do. The future looks really bright for Olive Diagnostics, so watch this space. Okay, last but by no means least, I'm joined in the studio with Matti. So Matti, the stage is yours.
Thank you so much. I'd also like to thank the previous presenters for their wonderful presentations. I mean, and now I don't have to kind of like describe the psychology of building trust or give like tangible examples of real life solutions. But in any case, I'll be diving into digital solutions. So what are the tangible things that you need to do in a digital solution to build trust with your end users? So let's dive into the case. So I'm a person that has a long history in building digital solutions, and especially working with content management, digital experience. Also, my other kind of passion is team building, but I also have a background in startup entrepreneurship. And in this case study that we're going to dive into, I was working as a project manager. And what I'd like to take you through in this presentation is first take a little bit of look at the case, then introduce the team, then look into the components of trust in a digital solution, which are the content, the visualizations, accessibility, and the robust technology needed to back everything up. So the case is this: the main site of the World Health Organization, the most important and trusted source of information for healthcare professionals all around the world, and to some extent also for like average humans on the face of the planet. The scale of the website is massive. It's over 100,000 or maybe 150,000 web pages. It was a massive event, undertaking for us. It's something that has a lot of like regional websites on top of the main site. We even built the website for the Global Health Observatory. It was just a massive 4-year engagement for us. We're involved in multiple roles. We were involved in the user experience design, the building of the platform, of the website, and even the integrations needed to third-party systems. Then, by chance, we got the worst case scenario happening during our watch. So COVID-19 happened while we were building the site. Well, actually, we had just kind of managed to build it up, and then this was the perfect test scenario to test that it actually was robust enough to handle everything. But I think we can move forward to looking a little bit more into the people who helped. Some of them are in the picture. I really want to highlight also that this is not just kind of people here at Siili Solutions, but it's also all the other vendors and the wonderful experts in Geneva, all over the world at the World Health Organization. And I'm going to kind of like just tell about all the lessons learned, and by no means are they in any case kind of like something that I have invented or our team is solely responsible for. But I still want to highlight that we do have a great team, and that's one prerequisite for a successful solution that you have a team that's capable of delivering. But let's dive into the topic of the day. And if you put yourself in the position of this poor person here in an emergency unit at a hospital in Brazil during the height of the pandemic, you're struggling for breath, you're in pain, you need to rely for your life on the ability of the professionals to give you the right treatment for you to survive. Also, to a lesser extent, when you look into a more mundane scenario where you're worried about your health, you want to use a digital solution to improve your health or to find information, you're in an equally vulnerable situation where you really need to be able to trust the information, trust the solution in a way that you're able to commit to it. There is no kind of final say in what are the components. These came pretty organically when I was looking into the case study that we've done of this project, a bit dividing the findings in 4 areas, looking into kind of the content, the visualizations used, accessibility, and then the robustness of the technology. But before you start, what you need to do is, as Bence mentioned earlier, use the empathy and the compassion towards the end user. So you really need to just listen and get the information what they actually need for them to be successful in their life. And the doctors, they need to take the Hippocratic oath, but I think that in the premise of building digital solutions, we too need to be really making a promise to ourselves in that we build a trustworthy solution for the end user. So let's jump into like very practical examples. Now here's an example of the World Health Organization, how the page is structured. So let's dive into this and see how it's built. So one key element is that, and this applies to every kind of solution, that you need to have uniform UI elements. So when you move from one part of the website or a solution to the other, the basic elements stay there, so that you don't have to kind of struggle in finding how to navigate back or how to navigate to the next step. This needs to be like crystal clear. And I want to tell you an example about what happened during this project. So when we went live for the first time, we had hardly just did a migration of maybe 10% of the content. So part of the content, even the majority of the content, was still getting served from the old system. And to be able to make it uniform, so that there wouldn't be a difference when you're on a newly created page or one of the old pages, what we did is we built a solution where we could inject the header and footer, which were using the newly created UI components, also to the old pages. And I think that this was a major breakthrough in allowing us to go live early and start getting the feedback early on, and to be able to further develop and establish a feedback loop and still have a uniform experience for the end users, which is attributing for the trust. I'll be talking a lot about language in this presentation, because it's such a crucial thing, because it's not just for a global solution. For example, if you think back to the high days, the first kind of months of the COVID epidemic, and maybe a little bit further when we started getting the vaccines. Even here in Finland, which is fairly uniform in terms of the population, we still had a problem with some user groups that they were turning into disinformation because they didn't have the material available in their own language. So they had like readily available information on their own language through social media, for example, but might in some cases cause misinformation or disinformation. So what the officials had to do is that they had to start creating content in Somali, in Farsi, in Arabic, all of these languages that have people who didn't have a good understanding of either Finnish, Swedish, or English, which were the kind of like main languages for the information spreading here in Finland. But it's not just languages; it's also that you have cultures within languages. So, for example, here in Finland, we speak Swedish. Part of us have Swedish as our native language, but it's not exactly the same as the Swedish they speak across the pond in Sweden. And same applies to Portugal and Brazil, for example, or Canada and France. So you really need to take this into account in so many ways. And I'm a big fan of machine translations, but if you're thinking about a real healthcare solution, which is tapping into really life-threatening or life-saving information, I wouldn't go for machine translation, but really looking for expert translators to create the content. Then another important thing about content is how you structure it. I've been developing websites professionally from like way back when they started. So in the beginning, I would get a brief from a company that, okay, here's our company structure. Here we have sales, we have marketing, etc. And then of course they would want the navigation of the website to reflect how the company was structured. Makes sense, right? Well, it doesn't, because you need to listen to the end users, how they perceive the information. What is it there for them? Like what does it look like from their point of view? And this is what we call the information architecture. And there was a lot of effort put into this, both on the regional side and on the main side, to get it in a way that would be accessible and kind of like intuitive for the majority of the users. You cannot get it like 100% right. I mean, there's one way of making this even better, and that's by personalizing it for the different user groups. But if you have a uniform user experience that's same for all, then you need to make some compromises, of course. But definitely take the input from the end users and not from your organizational structure. Then what's really important as well is how you use the language and how you use the space, the limited space that you have on the website. So make the message concise, make it really understandable. Don't use hard terminology that's not familiar for the end users, especially when you're talking to laymen, not the experts. Of course, when you think about the World Health Organization, part of the content is for experts. So it is totally okay to use expert language because it's relatable for them. And then, even though we tend to think that, okay, you're a doctor, you need information, you go to your laptop and you just find the information. Well, it doesn't happen that easily in many places in the world because you don't have the laptops. It's maybe the only device is your like a 10-year-old Android device, that your mobile phone, which maybe has a very crappy connection to the internet even. So this is really a key factor when you're designing on a global scale, but nowadays even on a local scale, because it's also a matter of convenience because if you think about when your users are back home, they don't necessarily want to kind of like take their laptop and from somewhere, but they'll just reach out to their pocket and find their mobile phone from there and start browsing. So when you're doing the design, there's a couple of things that I really want to highlight. One is the real estate. You have much less real estate. I mean, the surface area of the screen. So you need to be really careful how to use it, to use it in a very efficient way. And the other thing is that what I especially dislike is that what some people do is that they hide part of the information from mobile users. And this is especially a no-no in this kind of a scenario where you're creating content for experts, because they need to get all the facts, not just the main points. Then you have the different audiences. Like I said, in an ideal world, you would have a personalized website with like various different views for the different people. But here I've made a deliberate contrast. There's also a very unfair contrast because they're very different types of content. But I think that this really makes the point that if you're a professional, I mean, you don't mind reading a lot of text because that's what you do for a living. Like my parents were doctors. I mean, every night when they came from the hospital, they would open a medical journal and read the whole evening, like read what's happening in the field. So for a medical professional, it's totally fine to read like long texts. They don't mind. And also when they see graphics, they want it to be in a kind of scientific way and not like beautified with some infographics. But they want really clear, distinct information when it comes to like showing the statistics. Then again, when you think about us normal people, or the laymen, so what we want to do is that we want to get the information in a way that we don't feel stupid, so that we want to understand it, and that's why you need to use the terminology that we understand. And what's also nice is that you can use some of the tips that Bence gave in his presentation about using psychology in tapping into our feelings and using text and imagery that is somehow kind of tapping into feelings and creating this possibilities for habit changes. For example, what's evident in the picture on the right. Then let's look at visualizations. In healthcare, you're often in a situation where you need to make the invisible visible. I'm not saying that this is a perfect visualization, but it's still a good try of trying to make something that's totally invisible visible for us all, to make it better understandable. And then there are other means you can use also to improve the trustworthiness and the relatability, and that's storytelling and using imagery and text that's relatable for the end users. For example, if you're addressing a community in the Middle East or in Africa, you might want to use very different imagery than like addressing a community here in the Nordics, for example, or even in like Southeast Asia. It's people want to kind of relate to the imagery and relate to the message also on an emotional level, and that's also helping in achieving the behavioral changes that are needed to improve your health, for example. This same applies also for photographs. On the top left, you see a nice photo shoot, which is nicely composed and everything, done in the field, of course. So it has this authenticity factor as well. It's relatable because there's no white missionary person there meddling with the locals, but it's like everyone is from the same culture and if you think about the relatability within the culture, it's much more better this way. And then if you look at the bottom right, you see an image from the Ukraine during these terrible times that they're facing there. Obviously taken by a smartphone. Even the cropping isn't as good as it should be. The composition not maybe ideal, but what it gives is a sense of urgency, and it gives a sense of authenticity. That this is how I saw it in the field. I didn't have time to build the perfect composition because there was shelling going on in the background. So this is what the image conveys as something that's not visible in the image itself. Then if you want to do the data part right, I would really strongly urge you to take a look at the Global Health Observatory. It's one of the top places or top user interfaces for any heavy data driven website or solution. So now if you think about what makes data reliable and trustworthy for the professional is the fact that you get access also to the source data, and you can verify yourself that this is actually true, that this is not some kind of just a beautified presentation that is trying to convince me of something, but this gives you access. You can change the filter the data or build your own visualization on this based on the same actual data, or just retrieve the data and plug it in your own preferred tool, be it Power BI, Tableau, whatever, and make your own visualizations if you think that's better, or combine it with some other metrics. Okay, then let's take a look at one crucial factor for building trust, which is accessibility. And this is also important because this is also a mandatory part for at least us here in the EU. So you need to have your websites accessible. As I've highlighted many times, you need to have the local language support. And this is something also very evident here in accessibility. You need to be able to support different character sets. You need to be able to support text that goes from right to left and left to right. And if you take a look at the top row, where I've contrasted the Arabic version and the Chinese version, you can see that when you look at the top left corner version, in Arabic, when you write from the right to the left. So also the user interface needs to kind of reflect this change. So every component also needs to be readable from right to left, not just the text. So this is something that is really crucial when you're thinking about a global website, or even a local website where you have different types of character sets. And as you can see, I chose a version which is not perfect. If you take a look at the bottom left part, which is in Russian, and uses the Cyrillic alphabet, even though the font size is the same, there's trouble trying to fit all the text in these boxes, because the Cyrillic alphabet take a lot of space, and they have the words are typically quite long. So a lot of things that you need to take into account. Maybe something that comes into mind when we talk about accessibility is the alt texts. So visually impaired people need to get the visual information in textual format, so that the reader software can explain what's in the images. And then if you think about using the same picture in multiple languages, remember to also have the alt text also in the respective language, so that it's understandable for the end user. Then another thing that is not that self-evident is the contrast between the background and the text. So for it to be readable for people who are not blind but have visual impairment, are struggling with reading the text, so remember to measure the actual contrast between the text and the background, so that it's good enough for the end user. So it's very simple. There's a lot of good tool sets, open source stuff that you can use to do the measurements and find out that your website is accessible for all. Please use the tools, because that's the only safe way to move forward. Last but not least, let's take a look at what makes all of this possible. So the technology on the back. I really want to highlight the scenarios because of an actual fact that happened. When we were thinking about the project, we were thinking about some scenarios that we might have to tackle. And one of the scenarios was actually a pandemic. Of course, we were imagining maybe like Ebola virus or something like that, a little bit more gruesome, something that we've seen in movies or something like that. But anyway, a pandemic happened, and one of the reasons we could cope with it was because it was in our scenarios. Of course, we had multiple other scenarios also related to data breaches and security issues. Those are equally important, but I will not go into them because that's something that is not at my liberty to discuss. But what I want to say is that when you're thinking about the scenario, you typically think about how to prevent a scenario, which is really important. But what you also need to do is how to recover from a scenario. So it's actually turns out that it's not only the prevention that's important, but if in the recovery process, for example, you lose a lot of information, that's not really a good scenario then if you didn't kind of take that into account, that maybe you had a problem with the database and you lost everything for a day or two because of not having a proper recovery procedure for the scenario. What we relied heavily on here in the solution was a content delivery network. So the content delivery network is something that delivers the content to the users from the nearest location. It doesn't mean that you need to have these end servers in every country, but even on a regional level, it really helps, and it helps in taking care of the network latency. But it has other benefits as well. If you have a CDN layer, it isolates the master data from the end users, and it also is easier to tackle, for example, the denial of services attacks already on the CDN level, and not ever getting them through into the actual systems that support the solution. And in some areas, your basic CDN will not be enough, and you need to kind of have other means of delivering the content. And here I'm mainly thinking about countries like China and Russia, which require special procedures. So if you have end users in these countries, then please just contact us. We'll help you with those countries because it's a little bit different for them. Security is something that's paramount because we're talking about your health data, and so you really don't want your health data to be in malicious hands, or having a service used to breach some other data you have on your computer, on your system. And as always, when you think about security, the people are the weakest link. So you need to have good practices that you're really strict with when developing the system and the content and everything. So on every possible level. One thing that's where a lot of people go wrong is that you isolate the software development from the operation, and that's not really a good practice. And already back in the days, for example, Margaret Hamilton here in the picture was eager enough to go to the lunar module and test how her software worked in practice in the operations. So this DevOps mindset is not something new. It's actually been there right from the start. But at some point we took the wrong turn and isolated the development from operations, which was a very, very bad idea. Because what you need to have is this production first mindset. And with DevOps, it comes with automation. Again, reducing the human factor in every scenario, in deployments, in security, everywhere. It's really crucial that if there's an opportunity for automation, you use it. And I would like to introduce a term, what we call site reliability engineering, where we also automate scenarios where we need to scale up the computing, for example, or scale down the computing to save costs. Or we send automatic alerts or automatic recoveries to avoid, again, the human factor and reduce the needed manpower to keep the system up and running. And then the solid practices, if you're working with a multi-vendor environment, then it also helps in the cooperation and everyone working for the same goal. This is mainly just a reminder that despite here in the Nordics, we have good bandwidth everywhere. You can go to the forest and enjoy the good bandwidth. This doesn't happen in most countries in the world. So you really need to look into a very lean front-end layer and also scaling the images into different sizes for the different use cases, so that you don't ever put too much load on the end user's device and the bandwidth to get the information fast. But as takeaways, I would like to give you these three. One is the empathy and compassion, also highlighted by Bence and to some extent also by David, making the health diagnostics easy, having the end user in mind in every possible way, making it really easy for the end user to use your solution, make it accessible, make it relatable, make the information findable and everything understandable. Then the quality of the copywriting and imagery in healthcare is really important. You need to be uniform. You need to use experts in the languages you're providing the service on. It needs to be reliable, clear, and in some cases you can use storytelling to build a kind of emotional bond with the end user. And then everything this is made possible by a really robust solution. And using the DevOps mindset, making everything scalable, maintainable, usable, and secure. It's paramount for a trustworthy healthcare solution. And this is where I want to leave you from my presentation. And if you have further questions or want to discuss in more detail, just look me up on LinkedIn or Twitter and send me a personal message. I'll be happy to come to your organization and tell more.
Super. Thank you, Matti. And thank you for sharing that example of the World Health Organization. I think it's a great example of those 4 components of trust that you just walked us through there. So fantastic. So that wraps up our webinar today. I wanted to leave you with a couple of key takeaways when we think about building trust in the healthcare sector. So first up, we heard from Bence on behavioral design and the habit building loop, and how crucial and important this is when it comes to users taking action and interacting with your product. Secondly, we heard about the importance of creating a great user experience. So David mentioned this in relation to what he described as frictionless and a seamless experience. And really that's important in order to help the adoption of your digital product. And finally, we heard from Matti here with me in studio on those 4 components of trust, which I think, again, are crucial, where we think about quality content, robustness of technology, visualizations, and accessibility, again, when we're thinking about building those digital solutions. So I'd like to just thank you all for your time today. For any questions that have come through during the session, we're actually going to follow up with those afterwards. And I'd like to thank our speakers here today. We had a very international group, and it was great for them to be able to share their knowledge and expertise with us. And finally, a massive thank you to all of our viewers who have joined us from all over the world today. We appreciate you taking the time, and we hope you found this useful. We look forward to seeing you on the next one. Thank you, and have a great rest of your day.